eMental Health International Collaborative is a grouping of people who are the initial supporters and sponsors of an idea of international collaboration to come together around eMental health.
It used to be that it would take generations sometimes for information to get from one place to another, but not now. It's instantaneous. So the way that we are working now is that in a global society, it's not just global economics, it's global sharing of information.
Look, I'm a great fan that when you're looking to collaborate, particularly on an international level or geographically diverse level, that always make sure you've got time for some face-to-face meetings.
One of the challenges we're having when it comes to international collaboration at present is that it's sometimes seen as a costly thing. There are costs associated with traveling and staying and so on, but you'd never really count the alternative costs. What would it have cost if you had to invent all the different things yourself?
The contribution for eMental health and how it can improve outcomes for people is immense. Potentially a bit untapped at the moment. So we have a number of initiatives.
We are all basically starting from the same place in many ways. And so instead of us all learning individually, we can come together and build on the knowledge that we have all developed and accumulated over the last number of years.
I think one of the most pressing issues for our organization right now is how to fully integrate eMental health into our traditional system and maximize our resources.
It's really important to do no harm in whatever we do, and when you're developing new innovative fields, you need to be quite thoughtful about that.
Are we testing the right things, thinking about what we need to learn, I guess, to grow and change and do things differently?
Mental health services can significantly reduce barriers to care. Policymakers, planners and funders can benefit from not only data about outcomes which helps inform quality assurance activities, but also helps to develop their strategies in terms of not only digital mental health, but mental health more broadly.
It is possible to translate best practice from somewhere else in a completely different context, but it needs tailoring. It needs some real work around the context of that environment and the cultures that you're dealing with. It needs significant input from the Indigenous communities of that part of the world who you're developing it for.
For, I think, some populations, I think for Māori and Pacific populations, eMental health has the potential to democratise mental health treatment, mental health psychoeducation, mental health information, so that it can reach more people that currently aren't getting the support they need.
With eMental health, we're going to bridge that geographical divide. It won't matter where people are residing. We can give them access wherever they are.
I'm really inspired by eMHIC, as I see quite an intersection of countries and their thinking and people coming together, and there's just so much shared common ground that the opportunity to scale solutions and share them is enormous.
We need to understand eMental health as not just a piece of technology. We need to understand it needs to work in a very coordinated, balanced way across the needs of the service users who are going to access those services. Because if it does not work for them, it does not work at all.